Pregnancy and pregnant. During her life, which is characterized by her privacy and sensitivity, pregnancy is one of these stages, and every woman has to take care of her food, the nutrients she must eat to maintain her health, the growth of her fetus, and in general, to maintain a healthy, balanced diet is important for maintaining optimal health for life, and for women of childbearing age, good nutrition is important for preparing your body for pregnancy requirements. During pregnancy, women's nutrient needs increase. For example, pregnant women need an additional 240 calories a day in the second trimester of pregnancy, 452 calories a day in the third trimester of pregnancy, and an additional 975 milligrams of iron. While supplements can provide large amounts of micronutrients, a healthy balanced diet should form the basis for a woman's nutritional intake. Good nutrition is the most important just before pregnancy, and during the first 12 weeks of pregnancy. Pregnant diet. Healthy nutrition and maintaining a balanced diet are the beginning of a healthy pregnancy, and it should be noted that the needs of the pregnant woman vary from woman to woman, so a pregnant woman who is overweight needs to reduce the calories consumed after consulting a doctor, and in contrast, if the pregnant woman is underweight or is in her adolescence, she needs more calories, as well as requiring the pregnant woman who is expected to have some complications during this stage to additional nutritional needs, as well as the pregnant woman who is suffering from diabetes. Get a special diet that can be based on eating whole foods, getting a steady amount of carbohydrates at each meal, and explaining some of the healthier options that can be taken during the day during pregnancy. Healthy breakfast options: fresh fruits, unsweetened Greek yogurt with herbal tea, or oatmeal with walnuts and berries. Healthy lunch options: protein-containing salads such as smoked salmon and chicken cubes. Tortilla rolls with vegetables, beans. Vegetable soups. Healthy dinner options: half of the dish must contain vegetables, and a quarter of it must contain protein, such as beans, lentils, lean meat, or fish, while the last quarter of the dish must contain unrefined carbohydrates, such as brown rice, quinoa, or sweet potatoes, and with the addition of a tablespoon of healthy fats, such as olive oil, or nuts. Snack options: fruit, nuts, vegetable juices, protein shake, peanut butter, chickpeas and carrots. Pregnant needs of nutrients. There are some basic principles of healthy food that you should take care of during pregnancy. However, some nutrients are particularly needed by pregnant women, as outlined below. Folic acid. It is one of the vitamin B group, which helps reduce the risk of developing neural tube defects, serious brain and spinal cord abnormalities, and folic acid supplements have been shown to reduce the risk of premature birth, and pregnant women need what ranging from 400 to 800 mcg per day of folic acid before and during pregnancy, and from its rich food sources: leafy vegetables, citrus fruits, dried beans and peas. Calcium, where the mother and the fetus need calcium to strengthen the bones, teeth, and contributes to the maintenance of circulation, muscle supposition, nervous system, and pregnant woman needs 1,000 milligrams per day, while pregnant teenage women need to 1,300 milligrams per day, and are considered dairy products. Broccoli, turnips are a rich source of this ingredient, as well as many fruit juices and subsidized breakfast cereals. Vitamin D. This vitamin helps build the bones and teeth of the fetus, so the mother needs to eat 600 IU daily, and from its sources fatty fish, such as salmon, milk and orange juice supported by vitamin D. Iron. The body uses iron to manufacture hemoglobin, a protein found in red blood cells responsible for transporting oxygen to different body tissues, so iron helps to manufacture more blood to provide the fetus with oxygen, and the pregnant woman needs to double the amount iron intake compared to the amount needed by non-pregnant women. Iron deficiency may cause iron deficiency anemia. Severe deficiency during pregnancy increases the risk of premature birth, lower birth weight and increased risk of depression after childbirth. Pregnant women need 27 milligrams of iron per day by eating rich sources, such as fat-free red meat, poultry, fish and vegetables, and it is worth noting that iron is absorbed from its animal sources more easily compared to sources plant. To enhance its absorption from plant sources, and supplements are recommended when ingested by drinking juices rich in vitamin C, such as orange juice, tomato juice, or strawberries. Iodine, it is an important mineral that helps produce thyroid hormone necessary for growth, development, and iodine deficiency during pregnancy increases the risk of mental disability and destruction, in English, cretinism. It is recommended to take 150 micrograms of iodine per day for women who plan to become pregnant, during pregnancy, during breastfeeding. The sources of this element: food, seaweed, eggs, meat, as well as dairy products. Pregnant nutritional tips. Pregnant women are usually advised to eat too much in certain foods in exchange for avoiding other foods, and mention which foods should be kept away from during pregnancy. Mercury, which is found in some fish species, such as swordfish. Meat is not cooked or partially cooked, as some bacteria and viruses can pass through the placenta, harming the baby. Raw eggs or foods that contain them. Raw or undercooked takeaways. Rotten cheese, such as blue cheese, to avoid listeria infection, a group of bacteria that can cause fatal infections for pregnant women and their babies. Calorie-free foods such as cakes, biscuits, and desserts, many of which are rich in sugars and fats, and are low in nutrients. Non-food foods that pregnant women may sometimes crave, such as mud. If they are craving, it is worth checking with your doctor.